A warm welcome to you, Africa. Good morning, and thank you for joining us on the program. The latest Ebola outbreak in the Democratic Republic of the Congo DRC has entered a new phase after a case of the deadly virus was detected in the northwest city of Mbandaka. Health officials say the first urban case significantly escalates the risk of an epidemic. The UN World Health Organization, WHO, says going by the latest development, it will convene an emergency committee this Friday to consider the danger of the disease spreading to other countries.
Deep concern on Thursday grew among the residents of the Democratic Republic of Congo's capital, Kinshasa, after another case of the deadly Ebola virus was confirmed in a nearby city. Ebola was detected for the first time in the northwest city of Mbandaka, which has a population of 1 million people and situated on the Congo River, a major thoroughfare for trade and transport into the capital, Kinshasa. The city of Mbandaka is way too close to Kinshasa, and with Ebola reaching the city, what I want the authorities to do is to organize medical controls in airports, in ports, especially on boats coming from the infected side. They will really have to carefully watch the evolution of the situation to prevent Ebola from reaching the capital. If this Ebola outbreak ever reaches Kinshasa, what we are going to see is death here, and also because it is very dirty here. The government and the population must make an effort to improve the sanitation of the city, get rid of all the dirtiness, because the poor sanitation and healthy situation also favor the spread of the virus. So far, the latest epidemic in the DRC has killed 23 people. The UN and World Health Organization are scheduled to convene an emergency committee on Friday to consider the international risk of the Ebola outbreak. The expert committee will decide whether to declare a public health emergency of international concern on the DRC.
It should be noted that the vaccine approved by the Congolese authorities developed by the American company Merck is still not licensed. It is, however, proven effective during limited trials in West Africa in the biggest ever outbreak of Ebola, which killed 11,000 people, 11,300 people in Guinea, Liberia and Sierra Leone from 2014 to 2016. With this deadly experience, the financial mobilization at this time is significant. The WHO has mobilized $3.6 million. The Wellcome Trust Foundation has provided more than 2 million euros for research, and Italy has pledged to provide $300,000. The total amount expected is estimated at 25 million euros for the next 3 months.
And we are being joined now by DRC's Health Minister, Oli Ilunga. Mr. Olunga, the first case of Ebola in an urban area has been reported, and this surely calls for concern. What more do we need to know about this case?
What we must already say is that from the beginning, this epidemic presented particularities for us. It affected 2 health zones, that is Bikoro and Iboko. These 2 health zones are very close, especially Bikoro, which is close to Mbandaka. So for us, the potential risk of contamination in urban areas was enormous. So in everything we had planned, we were anticipating and taking steps to ensure that the response already included Mbandaka. So for us, it wasn't really a surprise. It's what we anticipated for from the start.
We are told that more than 300 people have had direct or indirect contact with Ebola patients since the beginning of the epidemic. Do you now have control over these people to prevent further spread?
I actually think that we should not let ourselves go towards figures that don't exist. In other words, there is a real follow-up, surveillance and case tracking strategy. So that means that most contacts today are with the suspicious cases. So when we do tests and the tests turn out to be positive or negative, in fact, unconfirmed suspicious cases, it actually reduces the number of people to be monitored. So we only focus on the case we are monitoring that have been in contact with confirmed confirmed cases. So whatever the number of people, whatever the number of contacts, it was a strategy that was very well put in place with community representatives. In fact, each community representative will have to monitor about a dozen contacts. The community representative is supervised by a nurse, and the nurse supervises 5 community representatives.
Le relais communautaire, lui, il est supervisé par un infirmier. Donc, un infirmier supervise.
And nurses in turn are supervised by an epidemiologist, and it is estimated that 1 epidemiologist is needed for every 5 nurses. So it's a strategy that's being put in place that really allows us to grow our ability and track contacts.
Monter en puissance et de traquer les contacts.
Mr. Ilunga, for the very first time, the WHO has dispatched thousands of the Ebola experimental vaccines, which you say you've now received to fight against this outbreak. What have you put in place to ensure a good use of the vaccines, and how sure are we about its potency for large-scale use as we have in this case?
Well, I think what we need to know here is that it is a vaccine whose efficiency has been proven. Efficiency was proven during the epidemic in West Africa. So we are not in a situation where we are going to experiment with a control group and a group that is receiving the medication. We are in a situation where the medicine has demonstrated its efficiency. In other words, in this case, what matters most is to do what is called pharmacovigilance. In other words, anyone who receives a medication that has demonstrated its efficiency must always be checked in the week, in the months to come, to ensure that the therapeutic response, the type of protection and immunity of the patient, is in line with what was expected. And that is the most important thing.
L'immunité du patient est conforme à ce qui était attendu, et c'est surtout ça le plus important.
According to the WHO, the establishment of 2 testing and analysis laboratories in the Mbandaka and Bikoro regions is very important to the fight or response to this epidemic. Do we have these laboratories already, and are they operational now?
Absolutely, which means that these laboratories have been ready since last week. So from last Wednesday and Thursday, we sent a fast laboratory to Mbandaka, and then I myself was in Bikoro this week. We set up the Bikoro laboratory. So as a reminder, when we were there on Sunday with the WHO Director General, the Bikoro laboratory was in operation.
Le directeur général de l'OMS, le laboratoire de Bikoro était en train de fonctionner.